So mental health is very much the same as physical health. We all have mental health, and it's always fluctuating. It's always going up and down. Some days we feel really good, some days we don't feel so good, and that can happen for lots of different reasons. It can be we could have a really rubbish night's sleep that night, and that can make us feel quite low, or we can have had something big that's kind of happened in the family. So that can kind of really go, our mental health can go up and down the same as it can with our physical health. A lot of the time we can look after our own physical health. If we've got a cold, for example, we can have an early night, we can take a Lemsip. But other times, if we feel too unwell, then we can kind of go to the doctors and get some support, and that's similar in terms of mental health. So the first thing to do would be looking after your mental health yourself, but after that, then you might need support, I guess, for that. Lots of studies have shown that mental health in young people is quite common, or mental health difficulties are quite common in young people. So 3 in 10 young people will have a diagnosable mental health condition, which means a mental health condition that needs support. So that's something to just kind of be aware of, that mental health is as serious as physical health, and we have to look after both of them, really. And the 2 most common mental health conditions are depression, and the other one is anxiety. Okay, so the best way to help somebody with mental health difficulties would be to talk, and I know that's really difficult, but sometimes it's to kind of just start a conversation with someone who you might notice things have changed for them. So similarly, it could be if you've noticed that they're not going out as much or not spending as much time with your group, or just other sort of indicators that are making you think that something's not quite right with them. Just start a conversation with them. It could be something as simple as, I've noticed that you've not been coming out with us as much. How is everything for you? And try and, if you're able to, use open-ended questions so that allows the other person to kind of talk. That's always a good thing to do. And be encouraging of them as well, and sort of show them that it takes courage to kind of talk about how they're feeling, and with that, not breaking trust as well. I know it's difficult, but sometimes it can be really damaging if someone tells you something that's really personal. It's to really kind of keep that trust going with them, and try and be as open with them as possible, and even telling them about how you're doing. Do you know what I mean? Sometimes we all feel like the way that we feel is just down to us, but actually other people feel really similarly. And the best way to kind of reassure yourself that you don't have a mental health condition necessarily, and that you just feel a bit anxious or you feel a bit low, is to talk to other people and kind of suss out whether or not other people feel the same. It can be quite a revelation when you speak to someone and say, oh, I have these particular thoughts, or I have these particular worries, and someone else says, oh yeah, no, I do too. It can kind of make you, kind of normalises it a little bit, and makes you kind of understand that other people are in a similar boat, and what you're experiencing is kind of normal. I don't really like that word, but in terms of what we all experience, it could be really similar. And so talking to other people would be a really good way of sussing out whether or not it is a mental health condition, or if it's just something that people naturally kind of have, really. Or it could be that, you can come down to student services if you need to. If you think it is a bit more than other people might be experiencing, you can always seek further help.